Riverside Pain Physicians.
So have you ever felt that burning pins and needles type of pain? It's really a common complaint for a lot of people. Dr. Adam Cartwright with Riverside Pain Physicians can help you find the underlying cause of that and a treatment option, because Dr. Cartwright, there is treatment for that.
There is indeed.
Yeah, a lot of people don't realize that, and I always talk about my poor dad whenever you guys come on the show because he's got that pins and needles thing down. It's like he's so afraid to do anything about it, and so
He needs to come see us.
I know, that's what I keep telling him, but now the bridges are closed in Charleston, so he's stuck, at least for today. Okay, let's dive into this. So peripheral neuropathy, what in the world is that?
Yep, so that's really just a big fancy term for when somebody has a problem or damage or injury to a nerve that's outside of the brain or the spinal cord. So all the little nerves that go to the feet and the toes and fingers and things of that sort, when those are inflamed, that can cause a lot of pain, and that's transmitted back to the brain where you sense it. But it's a very big complaint in the U.S. Up to 20 million patients have this.
So that's the tingling, that's the burning that people feel. It's
Exactly.
that sensation that's getting translated then back to the brain.
Exactly.
Okay, so what is causing that? Why
Yep.
why do we hurt like that?
So there's several different reasons why somebody can have this. The most common reason in the United States is specifically diabetic peripheral neuropathy. It's just when patients have diabetes, and it doesn't have to necessarily be long-standing diabetes to cause this, but it can range anywhere from HIV all the way to actually some of the medicines you might take to help you, like chemotherapy, can actually cause it as well.
And what, and really, there's a difference. I mean, if your leg falls asleep, what's causing that? That's just a circulation of blood flow versus something like this that would be, I'm sure, persistent and consistent.
Exactly. Yeah, that's really when your leg falls asleep. That's a very temporary sensation of what peripheral neuropathy would feel like on the long term. So it can often be kind of bothersome. It might not be the main reason why somebody's coming to see us. It's lots of times is an additional or peripheral complaint that comes in while they're also talking about something else.
Okay, so let's dive into the treatment, because that's what I'm sure a lot of people, if they suffer from this, they want to know, how can I get over this? How can I feel better?
Mm-hmm. So the treatment can range anything from medications that you can take either orally or a cream. There's actually one thing that's in hot peppers, the capsaicin that's in hot peppers can help treat this, and those are all specifically treating the symptoms of it. What you'd really like to do is approach it from two ways. Is one, treat the symptoms, and additionally treat the actual underlying cause, of course, as well. So for the diabetics, it would be to treat their blood sugars and their targets that they would want for that. But for some things, like if you had cancer and you're taking chemotherapy, you can't just stop the chemotherapy
Sure.
for it. So there's some things that we can do to just treat the symptoms related to that without having affecting their well-being as much.
Well, and that's what makes you guys really special, is the fact that you'll work with each individual patient and you will look at what medical problems, pre-existing medical problems that they have, treatment that they're getting for that, and then I'm sure work to then treat whatever pain that they have.
Exactly.
And what is it like for you to help people who, you know, come in with such pain, and then it must be life transforming, because I have a good friend that has persistent pain, and it's, you know, it's something that is debilitating. I mean, it's hard for them to get out of bed.
Yeah, the implications of this, especially this type of pain where it's something that's so common, it's hard to stratify, it's hard to quantify how much pain somebody's in for anything, really. But specifically with diabetic peripheral neuropathy, it's very hard to quantify that, and a lot of, I mean, there's just, you know, billions of dollars lost every year due to the implications in the workforce and time off work that is applied from this.
Yeah, some people say, I'll just grin and bear it, but you know.
Definitely don't do that.
Yeah.
Come in and see us.
Yeah, you don't, and that's the thing too. And beyond the peripheral neuropathy, you also treat pain really of any type. So if someone has an issue, come.
Oh yeah, so we treat a host. We treat acute as well as the chronic pain. So if somebody's outside today and they slip on the ice or something, we can see you for that. But and we can usually get appointments in within a day or two. So we definitely try to help the patients any way we can, and we can also talk with their other doctors, so we don't necessarily take ownership of everything. If they have diabetes or some other type of reason, let's say they maybe have peripheral neuropathy, we'll be in consult with their regular doctor as well to making sure we're getting the best treatment for them.
Dr. Cartwright, thank you, sir, for coming in. We appreciate you, and thanks so much to Riverside Pain Physicians for coming on and sponsoring this segment. And for more information about pain management, the physicians and their locations, you can go to riversidepainphysicians.com, or you can call them 904-389-1010.